This is Dr. Stacy Haynes. I'm here with Dr. Runels. We all know Dr. Runels as the inventor of the O shot and the P shot. We've just finished training. Of course, I've already done it, but I'm here just from some little pointers, and it has been wonderful. So, Dr. Runels.
Oh, Dr. Haynes, I just want you guys to know she's your physician. Just a brilliant, personable, amazing woman. And we've been swapping notes about some difficult problems for which others have no solution, like some of the darkness under the eyes and some of the things that difficult problems like lichen sclerosis. And as a dermatologist, to be able to work with you, I just want you to know I consider it an honor. And anybody that's your patient, I think, should feel very blessed to have you as a physician. I really do believe that.
Thank you so much. I really appreciate that. My question to you, the first question is, and we're going to make it real short because it's been a very long day, but what actually got you into the P shot or the private shot as it's known?
Yeah, you know, I was taking care, I was trained as an internist, as you know, and I was taking care of women just as their general physician, and part of that involved doing hormones and just making it safe for women to talk to me. I found out how frequent and the family suffers because of sexual relations, and being sensitive to that as a physician who was dealing with women's hormones and their it just became very bothersome to me how often families were strained, and sometimes the husband may not even know, and for sure the best friend often never even knows that her sister is suffering with strained sexual relations, which can rip families apart. So when this technology of using blood-derived growth factors to generate tissue came along, I thought this might be something that might help with this problem, and it does. And having bright physicians like yourself who are well trained with difficult to treat problems in the dermatological arena, like lichen sclerosis and rejuvenation of tissue that's scarred, that's it's turning out it's changing lives. It really is changing lives. Unfortunately, we are in now about 15 countries, but still most of the doctors on the planet are still learning about our research.
Correct.
So to have you help spread the word is really an honor.
Oh, no, it's an honor to work with you. So I know all the men that are listening want to know, are the results as good as we think they are?
Yeah, you know, I like to be careful not to make anything a magic shot. On the other hand, if you're a man, you know that Tiger Woods and every NFL football player is getting injected. If they're around long enough, they're going to be injected in their knees to help maintain their knee. And they're doing that with platelet-rich plasma. They're taking the blood, they're getting that same growth factor that when you scrape your knee, it makes the skin grow back, and they're putting in the elite athletes to help them keep their joints healthy. They've done that for 10 years. Well, you know what? It really does work to maintain the health of your skin and your genitalia. Does it make a knee that's been completely blown out where you don't have to do surgery? No. Sometimes it's so gone you have to do surgery. But it can save a knee from having to be artificially salvaged in many, many cases. And in the same way, if a man has some function already there, this can be life-saving to a marriage. This can be life-changing to be able to rejuvenate your genitalia in the same way that you would do your knee. Why should the NFL football player knees get all the good fun,
Exactly.
right?
I think that's a great analogy that most people can actually relate to. That you're rejuvenating other areas. If you can do it to the knee, why can't you do it to that area also?
Yeah, and as a
dermatologist, that's a wonderful analogy.
You know that as a dermatologist, this technology has been used to heal wounds for 10 years.
Exactly.
But finally, I think part of it is just that even in this modern age of 50 Shades of Grey and the new sex revolution, it really is true that it takes a very brave physician to still be able to talk about sex.
Exactly.
Because even though it's part of who we are, it's part of every religion, how to deal with sex. It's part of every family, how to deal with sex. It still takes a lot of courage to speak openly like you're doing.
Exactly.
A lot of courage, because people will want to criticize you. So for that reason, I think the technology wasn't adapted as early as it could have been because doctors being afraid. Think about, we have over 20 drugs for men to help them with their sexuality.
Right.
We finally got one drug for women, and it's a psych drug. It's a spin-off of Prozac.
Right.
We still don't have anything for women that's a medicine that's FDA approved that rejuvenates the vaginal tissue. But we have a procedure that does that.
Exactly.
That involves your own blood. It's not even a drug.
Great.
So, but again, I want to salute you because there's a lot of dermatologists out there. But to have a woman who's brave enough to say, you know what, these are families, these are people that have this problem that I can help, and so I'm just going to decide not to be embarrassed. And you had to make that decision, didn't you?
Of course, of course. I'd just like to take this opportunity to thank Dr. Runels for taking the time to speak with us about the O shot.
And my hometown too, right?
Yes, from Birmingham.
We have to always level each other
Always
because we're
remember
both
that.
from the Smoky City, which isn't that smoky as it was when I grew up.
No, it was not. But anyway, thank you so much for speaking with us about the O shot and the priapus shot or the P shot. If you have any more questions or you have anything else you need to find out, please go to the website www.drstacyhaynes.com.